I am super excited to welcome back Natalie Berkman. She is a counselor who actually has spoken before, and it was fabulous at the time. So I'm excited to hear what she has to say tonight about a very commonly discussed topic called rejection sensitivity. So I'm very excited to hear about that. She's going to introduce herself here in a moment. But I need to give the disclaimer from the CHAD site, and I lost the slides, so I might not do that. I might just say that CHAD basically wants everyone to hear all the information, but they don't endorse any particular therapy or person or anything else. And that is very much a shortened version of their disclaimer. But I can send that out when I send out the PDFs of worksheets that Natalie has so kindly donated to us so that everybody can work on these skills at home after she talks about them. All right, well, Natalie, I'll let you take it away.
Okay, thank you, Kristen. So I am glad to be here this evening. Let me go ahead and share my screen so that we can do my PowerPoint together. And let me go into presentation mode. There we go. Okay. So I'm really glad to be here talking about rejection sensitive dysphoria tonight. It's a topic that comes up a lot in my work, and I'll talk about what I do in just a moment. But it's a really common feature of ADHD, and it can be really challenging for individuals with ADHD to cope with it. And so I'm hoping to give everyone some pointers today on just different ways that you can help your child manage this aspect of their ADHD if it comes up for them. And just different strategies that you can use that might be helpful. So just a little bit about me. I am an LPC, and I work at Johnson County Community College part-time in their counseling department, working with students. In my area of specialty at the college is working with students with autism and ADHD. So that's really my passion. I love that student population. So I primarily see students who receive access services at JCCC for those diagnoses. And then I also, a couple times a month, run expressive therapy groups at Signature Psychiatric Hospital. I really love acute inpatient mental health, and so I enjoy that aspect of my career as well. I love working with hospitalized patients. And in that setting, I do see a lot of patients with ADHD as one of the comorbidities. So usually it's not what brought them to the hospital, but a lot of times it does exacerbate the other mental health challenges that they have. And so we work on some of their ADHD symptoms as part of their therapy in the hospital. And I would say in both populations that I work with, I do see rejection sensitivity being a really challenging thing to deal with, and especially inhibiting some areas of their life. And we'll talk about that, kind of the areas that it tends to pop up and how it affects individuals across, all the way from elementary school through adulthood. There's different ways that it can come up and make things challenging. So those are kind of my two roles in my background. I also have three kiddos. I have a 6-year-old, a 3-year-old, and an almost 1-year-old. And so they keep me busy. And actually, one of the reasons I've been interested in rejection sensitivity is my 6-year-old. She's not currently diagnosed with ADHD, but she definitely struggles with rejection sensitivity. And that's been a big thing we've been working on with her and helping her cope with that, and be willing to put herself out there a little bit and take some risks, because that's definitely an aspect of rejection sensitivity that's challenging. So I'll talk a little bit about my personal experiences with that as well. So just to get started, what is rejection sensitive dysphoria? So it sounds like a diagnosis, but it's really not. It's not any type of disorder. It's not something that your child can be diagnosed with. It's just a term to describe an emotional experience that they may have either before a potential opportunity for rejection. So trying out for a sports team, trying out for the school play, asking a question in class, anything that could potentially result in a perceived rejection, or if they experience something that feels like rejection to them. So they find out their friends had a play date and they weren't invited to it, or, they applied for a job and they didn't get it. So either that experience anticipating or processing a potential rejection. And that really leads to the internal experience is really, it's kind of rooted in shame and sadness. It can also feel like anxiety, fear. There's just, those kind of intense negative emotions. For some people, it really provokes like a fight or flight type sense in them. The external behaviors that you're going to see with rejection sensitive dysphoria is going to vary based on your child's temperament. So some kids really, go inward and they get really sad or they get withdrawn. Other kids, it's going to come out as anger. So I do think a lot of times when we see ADHD kids get angry, especially in the school setting, it can be tied to rejection sensitive dysphoria and a perceived rejection by a peer or a teacher. They're feeling sad and shame inside, but what it comes out as is, rage or maybe a mean comment or something that the way they're externalizing it comes across as angry. So it's becoming a more commonly recognized feature of ADHD. Just in the last few years, there's been a lot of identification of it, more research around it, more discussion of it as a common symptom, and something that people with ADHD deal with. It's not 100% clear at this point why individuals with ADHD process rejection more deeply than other people. They think there's a couple of theories, one of which is that people with ADHD receive a lot more negative feedback starting in an early age, right? They're corrected by preschool teachers and they're corrected by their parents. And there's just a lot more of that feedback of you're doing something wrong, you need to do something different. And that can lower self-esteem and increase sensitivity to negative feedback. So that's one school of thought. Another school of thought is that ADHD is a different wiring of the brain. And so the way that the brain is going to process stimuli will be different in ADHD brains than in a typical brain. And the way, when they image the brain, our brains process rejection in the same area that they process pain. And so rejection really is a painful experience for anyone, ADHD or not. It feels horrible to be rejected. That gets into how, humans are primates and we're group creatures and we're, it's just being part of the in-group is really important for survival. And so there's just a lot of like evolutionary things tied to, it's really important for us to be part of a group, and being excluded from the group is going to feel bad to our brains. And because the ADHD brain processes stimuli a little bit differently, is a little bit more sensitive and reactive to stimuli, it's thought that maybe that reaction to rejection is amplified in the ADHD brain. And so regulation of brain signals can potentially help with that. And so when we talk about how to treat rejection sensitive dysphoria, a lot of the treatments that work on ADHD symptoms in general, right, helping the brain to focus, helping the brain to process a little bit more slowly and slow down, will also help with rejection sensitive dysphoria. But we'll talk about that in just a moment. So common experiences for people with rejection sensitive dysphoria. One thing that you might see a lot in kids is interpreting neutral interactions as negative. So you might say, hey, my daughter, I need you to go change your shoes. The shoes you're wearing are not appropriate for school today. You're going to be doing PE, so you need your tennis shoes. And that to you might feel like a really neutral statement, right? You're just telling them a fact, it's PE day, you need to wear PE shoes. Well, for a kid with RSD, they might really interpret that as a criticism, right? You picked the wrong shoes and that was not correct, right? And so there you could see a lot of sensitivity even to things that you are saying to your child as a parent, because they're feeling criticized a lot, even when it's not intended as a criticism. That's something I deal with my kindergartner quite a bit. It's just those every day, here's what you need to do. She thinks that because she didn't anticipate that, and I'm having to tell her that that is negative feedback, right? That she should have known. And so there's just a lot that gets tied up in that. And I think that one can be the hardest as a parent, because you're having to give your kid a lot of reminders throughout the day, especially a kiddo with ADHD is probably going to need your feedback and reminders and prompting a lot. And so if they're interpreting all of that as criticism and it's activating that rejection sensitivity, that, they might start reacting to you really negatively. You might see some of that anger that I talked about on the previous slide come out. Because they're feeling that as criticism. And again, that's just getting at, some of their low self-esteem and also just the way that their brain is processing your verbal input. And so some of the things that we'll talk about are how to help coach your child through that so they're not viewing it as so negatively. It can also appear as fear of asking questions at school. And this is the biggest thing I see with my college students at JCCC. A lot of my students will come to me and say, I I know I need to talk to my professor, but I just don't even know how. Like, I'm really afraid to approach this person. I see them in class every week and I really like them, but I just don't feel like I can talk to them. And that can be really debilitating, but it's rooted in that, what if I ask them a question and they tell me, well, I covered that in class, how do you not remember that I already answered that? And so a lot of times adults aren't as empathic when they're reacting to students. And so they, especially ADHD kids that have been through school and maybe have had that feedback before where, they missed something because they were distracted, and then they ask the question and they get that, well, you should have known this because I already talked about that. It can really ingrain a fear of asking questions in school that can follow them all the way into college. And so I do a lot of coaching with my students at JCCC around how to have a conversation with their professor, how to kind of couch things if they're worried, like, maybe he did cover this in class, ways to phrase it so that you're kind of acknowledging, maybe I missed this, but I just wanted to check with you, here's my question. And so we do a lot of role playing, and I'll talk about that a little bit more, just so that they can kind of go through those scenarios and feel more comfortable with how the conversation might go. Difficulty coping if they feel left out. This one's hard, especially that goes all the way through elementary school through high school. Kiddos with rejection sensitivity are going to be more tuned in. So if they hear kids talking about a group activity that they weren't part of, a party that they didn't get invited to, anything like that, it's going to hurt deeper than for the average kid. And so that's another one, talking to your kid about their feelings. If they're coming to you and saying that they're having that experience, can be really helpful. But that they're definitely going to, have that sense of loss or isolation is going to feel a little bit more deep and a little bit more lasting for kids with RSD than for the average kid. Struggling with any negative feedback, report cards can be really hard. Parent teacher conferences, IEP meetings. If your child is on an IEP or a 504 and they go to their IEP meetings, be prepared that can be a really triggering experience for RSD, because even if their teachers say 80% great things about them, they're really going to focus on that 20% of areas for improvement or things that the kiddo could do better. It's just their brain is going to go there and focus on that feedback. And so preparing them ahead of time and debriefing with them afterwards can really help with that, and so that they can process those emotions. And then the last one, I also see this a lot with my students at JCCC, fear of applying for jobs, applying for internships, trying out for sports teams, anything where there's a good chance, they're going to put themselves out there, take a risk, and then experience that rejection. And so that's another hard one with RSD. And you might have seen some of this with your own kids, as you're parenting, it comes up in a number of different situations. But we'll talk about different strategies that can help prepare ahead of time for those situations, and then also follow up if they do end up with hurt feelings, how to kind of process that with them. So like I mentioned a few minutes ago, ADHD treatment is really going to help with RSD. So anything that you're generally doing to help your child with their focus, sustained attention, helping them, calm themselves, center themselves. Medication, ADHD medication is also going to help with RSD, because the more that their brain is kind of focused and calm, the better they're going to be able to process that information of how a scenario is going, how an interaction is going. And they can emotionally respond to it a little bit less impulsively, because really that rejection sensitivity is kind of an impulse thing. Immediately they're jumping to this negative place as they're interpreting the event in their mind. So, anything that you can do that you're already doing for ADHD will help. In addition to that, we'll talk about cognitive behavioral therapy. That's just kind of reframing the way that they're thinking about things. So kind of challenging the natural thought processes that they're having about the interaction where they felt rejected, helping them to rethink it in a different light and maybe see some other options for how they can interpret what happened. Mindfulness and just kind of self-soothing, staying in the moment, not catastrophizing. And we'll talk about some strategies for that. And then also just your input. So parenting can really, really help with RSD. Just your willingness to talk to your child about what they're feeling, process the emotions with them, having a trusted sounding board to discuss difficult emotions with is really powerful for this. And so you're going to be a great resource for your child, and just being there to talk with them, have an open conversation about if they are feeling a sense of rejection, and normalizing that experience for them and then helping them move forward. So the first one I'll talk about is the cognitive behavioral therapy. And so this is kind of a three-part technique. So if there's a situation that's coming up where you think the child might experience RSD, you can help them prepare for that situation. So, let's say it is a 504 meeting and you're saying, Johnny, I think you've done a great job at school this year. Part of your teacher's job is to talk about areas for you to continue improving on. So you're going to probably hear some great things that you've done, but you're also going to hear some areas for improvement. That doesn't mean that your teachers don't like you or think that you're doing a bad job. It's just their job to keep continually giving you ideas for how to keep improving, and so just helping them understand and contextualize the situation. And also just kind of thinking through, the situation might not go the way I wanted to, and I might have hurt feelings afterwards, and that's okay, just kind of preparing themselves ahead of time. And that just kind of clues them in, I don't necessarily need to react like this is a big deal because this is an expected outcome of the situation. And so it just gives them a chance to kind of prime themselves to react in a little bit more modulated way. Reviewing with the situation with objectivity is about, your brain is going to go to the negative, but what do you think someone else would say? If they were hearing your teacher's feedback in your 504 meeting, do you think they would say that your teacher thought you were a really terrible student, or do you think they would view it differently? And so just being able to put themselves in an outside observer's shoes can help them see, okay, well, what she said wasn't that bad. Like, I guess it does mean that she likes me and she thinks I'm doing a good job. So just having them, take themselves out of it for a second and say, if we're looking at this without any sort of preconceived notions, what do you think you would think of it? And then challenging the flawed beliefs. So a lot of our thought patterns for anyone can skew to the negative, and it's just kind of a habitual thing that we do. And so when we challenge our flawed beliefs, we're giving ourselves a chance to kind of rethink some of those automatic thoughts that we have. So if they're automatically thinking, okay, well, that person didn't smile at me, so that must mean they hate me and they don't want to be my friend. Well, there's lots of reasons why someone might not be friendly to you today, and it's not always a rejection of you. It's not always personal. Let's think through other reasons why that could have happened. And so just helping, again, broaden their thinking about the situation so it doesn't necessarily go straight to that rejection concept can be really helpful. And so I'll show you a preview of the cognitive behavioral therapy worksheets that Kristen will be sending out after the talk, because they have some really good guided ways of talking to your child about different scenarios and just helping with these three skills so that you can really practice that and actually review a concrete situation. So if there's a situation that your child is struggling with in particular, you can use the worksheets to kind of process it with them and help both with the, objectivity and challenging flawed beliefs. And then also just get in the habit of maybe mentally preparing for situations. If there's a situation that your child's going to enter into that might provoke RSD, you can use the worksheets as kind of a primer to help prepare them for that as well. So mindfulness, really the thing about mindfulness that I find most helpful when working with kids, and especially difficult emotions, is just the concept that your feelings are transient. They're going to pass. You're not going to feel this way forever. Your feelings are uncomfortable, but they're not actually going to hurt you. So no matter how bad you feel, a feeling is just there for a period of time and it will move on. And then also that there's things that you can do yourself if your feelings are hurt. So having some coping skills ready to go, and asking your child, what makes you feel good about yourself? So if you had a bad day at school and you felt like, somebody said something to you that made you feel rejected, well, what's something that makes you feel good about yourself? And let's lean into that. So if soccer practice, you feel really good about how you play soccer, instead of dwelling in the negative emotion, focusing on what's the next thing that we're going to do that's going to, be something that you're really good at and that validates that you're, a great kid. So just bringing them back to the positive. And also, who can I talk to about how I feel? So the best thing that we can do to support someone who's feeling that rejection sensitive dysphoria is to process those feelings with them and help them work through it. And so just, letting them know that you're someone that they can talk to about how they feel, or, if they are feeling hurt at school, you can talk to your counselor or you can talk to your teacher and process those feelings, letting them know they're not alone in that. So just some essential coping skills, but again, just sort of helping them put their mind around, everyone has bad feelings. Sometimes everyone's feelings get hurt. Sometimes there's ways that we can cope with it and move forward. That's really helpful. So when you talk to your child about feelings of rejection, the first thing I encourage is to validate how they feel. So, it can be tempting to immediately go to, well, you shouldn't feel rejected because obviously, your friend really likes you and he just probably didn't want to play with you today because, he wanted to be alone. And that's fine to go there for sure. You can definitely have that conversation. But the first thing that's going to really help is just to say, I understand why you feel rejected. I understand why that hurt your feelings. I would feel hurt too, I think, if I had been through that situation, and just letting them know that there's nothing wrong with feeling upset about the situation, but then asking them, to talk about it a little more and then helping them reframe it. I also think a lot of times kids with ADHD feel like they are the only one, they are the only one who the teacher doesn't like. They're the only one who feels so bad about themselves. And so the more that you can normalize feeling rejected as a universal experience, we all have experiences of rejection. We're all going to feel that way sometimes. So sharing your own experiences of maybe, something similar. So if your child feels left out of their friend group, talking about when you were a kid and you didn't get invited to the sleepover, and sharing that experience with them so they understand that that's a commonality, that all kids feel that way sometimes. Talking about how you coped with it, how you move forward, what you did instead of going to the sleepover and how that ended up being a great thing. Just kind of reframing the situation that you were in and the coping skills that you used. You can also talk about famous people's experiences of rejection. Like I know when I was a school counselor, I would tell kids all the time about how Michael Jordan, didn't make his high school basketball team, or there's some great story that he told about, not being the best at basketball when he was a kid. And so it really helps kids to hear like that their heroes had experiences of rejection too. And no one is perfect their whole life. Everyone has those letdowns and those times that people doubt them or don't want to be their friend or whatever it is. The more we can normalize that experience, the more it's going to help. Role playing is really powerful too. I think I mentioned that before. If there's going to be a situation, like talking to a teacher and your child's afraid of that, or interviewing for a job, or anything that you can kind of walk through the possible ways that it might go and play those out with them, it can be really helpful, because I think a lot of times kids with ADHD imagine a situation going so horribly and they can't even really describe what so horribly would be. It just feels really intimidating. But when you start to break it down, well, what's the worst that could happen? So he says that's a dumb question. So is that a reflection of you, or does that just mean that he's not a very nice guy? And so if you talk through it, it kind of takes that scary factor away and helps them to realize that if the other person truly is going to react in a really awful way, that's not your child's problem, that's the problem of the other person. And so it just kind of, again, like breaks down that wall of fear that a lot of kids will put into, a certain situation that they might be really dreading. And then praising your child when they take a risk. So, I think, trying out for a sports team, trying out for the school play, reading in front of the class, like anything that your child does that is taking a risk of potential rejection, but they're willing to put themselves out there, really make an effort to praise that, because the more that they feel validated for trying, that encouragement is really going to help override some of that, those negative feelings that they might have around risking potential rejection. And your feedback is so important to your child. And once they reach middle school and high school, it might not feel like they're really listening to what you have to say or taking your feedback seriously, but no matter how old your child is, you are still probably the most influential person in terms of, how they feel about themselves. And so don't underestimate how much your praise, your encouragement, your willingness to talk to your child, it's really, really powerful. Even for college kids, their parents' input really means a lot to them. So, sending them that encouraging text message before a job interview or after a job interview, it means a lot to them to hear that you believe in them, and it can really help them boost their negative, or switch their negative self-talk into something more positive as well. So there's a number of resources that I really like about rejection for kids of different ages. So the first site I wanted to show you, this is the Cleveland Clinic's website on rejection sensitive dysphoria. And I feel like it's one of the most helpful resources I found that kind of goes into what it is, what it means, and how it might be affecting individuals with ADHD and kind of why it exists. So if you want more information on kind of the science behind rejection sensitive dysphoria, this website is definitely a good place to start. And there's a number of books as well that you can get on the topic and how it affects people with ADHD that go a lot deeper into it. Like I said, it's kind of a growing area that is becoming more well-known among people who work with individuals with ADHD. And so there's more and more coming out about different strategies for dealing with it. But I think this Cleveland Clinic page is a really good place to start. And then back to the PowerPoint slide. With younger kiddos, I really like to use books to help them kind of learn about different feelings. And so there's a great book that I found by a psychologist named Beth Curtin, and it's called When I Feel Rejected. And so again, it's just like normalizing that experience that everyone feels rejected sometimes, and there's ways that you can cope with it. And it's a really normal experience. You're not, the only one who's ever been through that. So that's a great book. What's in Your Mind Today is a really good mindfulness book for kids. And it talks about that fleeting nature of feelings. So you might have a really negative feeling, but it's going to pass and you're going to feel differently, in an hour or tomorrow morning. And so just helping them to understand that, your feelings might be uncomfortable in the moment, but you don't have to necessarily like dwell in it or feel bad about how you feel. It's a feeling. It's just something that your brain is having passed through, and you don't have to necessarily get really bogged down in a negative feeling or a negative experience. And then this last one, I Can Handle It. It's another mindfulness book. It's by Lori Wright, and it's just helping kids have some positive messages about, even if something bad happens or, have a negative experience or I feel upset, I can handle it. And so just that empowerment that, no matter what hard situation you find yourself in, having that self-confidence that you're going to get through it and it's going to be okay. I think sometimes when we attend to ADHD kiddos' feelings and in kind of like a behavioral management light, it can make them feel less empowered to handle their own negative emotions. And so building up that confidence that even if something bad happens, they're building the skills, they have the toolkit to really manage their own feelings and process what they're feeling. Again, it's just about empowerment and helping them feel confident, improve their self-talk a little bit with that one. So I'll pull up some of the cognitive behavioral therapy worksheets that I mentioned and talk through some of these skills a little bit so that you can use these when you're working with your child. So I tried to kind of put them in an order where it would make sense to start and then continue on working. So the first one is just kind of an introduction to cognitive behavioral therapy, and it's going to look at a situation. So if you're working with your child, you can think of the most recent situation where rejection sensitive dysphoria came up for them. So maybe it was, a friend didn't want to play with them at recess, or they tried out for the volleyball team and they didn't make it. And so you're going to process it with them as what did you think? What was your automatic thought? Because their automatic thought is going to be, well, everyone hates me, or I'm horrible at volleyball. I shouldn't even try it out. I'm embarrassed that I, tried out. But the alternative thought, and that's going to take some coaching from you, is, let's dig a little bit deeper. Well, how many people tried out for volleyball? Okay, well, if there were 35 kids who tried out and there's only 15 spots, more than half of the kids who tried out aren't going to make the team, and so just helping them to understand there's different ways of looking at the situation and just kind of open their mind to the other scenarios, right? Your friend didn't want to play with you at recess. Well, maybe your friend was having a bad day and they just wanted to be alone, and that's okay. It's not necessarily about you. Sometimes people are just in a bad mood. And so just going through that with them, it might be uncomfortable for them at first and you might get some resistance. But with practice, this is a process that gets easier for kiddos to start thinking about alternate thoughts or alternate scenarios. And then you're going to talk about what was your feeling. So again, it might be hard for them to put labels on it. And so you might have to really coach them through that. A lot of times kids don't like to admit that they felt hurt or that they felt embarrassed or Those are hard things to talk about. But if you can relate, and like we talked about on the previous slide, when you tell them about experiences that you had of rejection or experiences when you got your feelings hurt, and you can label those feelings that you had, that's going to help them to be more willing to label their own feelings and feel okay, expressing that. And then you can say, well, okay, if we look at it in this alternate light, how would it have made you feel? Like when you realize more than half of the kids weren't going to make the volleyball team, how do you feel about the fact that you didn't make it? Well, I've only been playing volleyball for a year. And so I guess it makes sense, that I wasn't in the top 15, and, I'll keep playing on a recreational team and keep getting better. And then maybe I'll try out next year, so that you're just helping them kind of rethink things and put things in a different perspective. And then what was the behavior? So this is really helpful if you are having issues with your kiddo reacting to their rejection sensitivity with angry outbursts or meltdowns or any problematic behaviors. This part can be really helpful because you can talk about, okay, well, so your feeling was really hurt or really embarrassed, and that made you yell and slam the door and refuse to come down for dinner. But when we think about it in this other way, like what if we thought about it as, it makes sense that you weren't going to make the team because only 15 kids were going to make the team, and but you're really proud of yourself for trying out. How would you have reacted differently? And so that really helps them do some behavioral reflection too, because sometimes the rejection sensitivity gets a little bit ingrained by the negative outburst that follows. And so then they're getting negative feedback again because they had a negative outburst after the fact. And so it's just kind of creating a negative cycle. So by thinking about, okay, well, if we process the situation differently, how do you think you would have reacted? It can kind of help them, guide them into a different behavior pattern, and let them know, your feelings have led you to this behavior. So you're not a bad kid. It's just, of course, you were feeling hurt and embarrassed and ashamed. That made you want to slam the door. But if you were thinking about this in a different light and you weren't feeling embarrassed and ashamed, you probably could have been, talked about it with mom calmly. And that just, again, gives them that validation that they're not a bad person. They're not deserving of bad things happening to them. It's just giving, again, like a reframe so that they're not feeling that negative self-talk continue that cycle. So I really like this first worksheet, and I definitely encourage you to give it a try with your kiddo if you think it might be helpful for them. The next one gets at what is a fact and what's an opinion. So this is your kid, depending on their age, might already have this mastered, but some kids really struggle with, if I have a thought and I'm really sure about it, it must be a fact, right? So I really think that my friend Kate hates me because she didn't talk to me today. And I know it's true because I really feel like she hates me. And so helping them to understand, well, there's a lot of evidence that Kate doesn't hate you. So let's look at that. So it's not a fact, it's an opinion, and just breaking that down so that they're understanding, just because you really, really believe it to be true doesn't necessarily mean it's true. Sometimes your brain is kind of processing things in a flawed way because you're only letting that negative side of the evidence in. Well, let's look at the positive evidence. Kate invited you for a play date last month, and Kate wanted to sit by you at lunch yesterday. So the evidence really shows us that she was just in a bad mood today. So the more that we can kind of challenge that black and white thinking that, they must hate me, or I must be a bad kid, or my teacher doesn't want me to ask a question, can really help reframe some of this. And so it might seem kind of silly, but I definitely encourage you to go through this with your child and just see what they say, and what kind of conversation you can have about fact versus opinion and how it might be changing their thought processes to the negative. The next one, these are questions, and you don't necessarily have to use this as a worksheet with your kiddo. If you just want to have these questions in mind when you're talking through situations with your kids, that can be helpful too, because it's just encouraging a process of kind of deconstructing the narrative that they've built, right? So they're going to come home and say, I know Kate hates me because she didn't want to play with me on the playground today, and she played with Maggie instead, and I was all alone. And so they have this whole thing, and they probably built it up in their mind, and they've thought about it, all afternoon because they're upset about it, and they've really kind of put together this whole thought in their head of how things are and why they're never going to be friends with Maggie again, or Kate and Maggie, because they hate her. So the more that you can ask them questions, and you don't have to necessarily say, well, I think you're wrong, but just asking questions and getting them to maybe think about it a little bit differently can, again, kind of help break down negative thought cycle and allow in some more information that might kind of lead them to like a more neutral place about what happened. So what kind of evidence is there for what you're thinking? Is there any evidence against it? Is it based on facts or feelings? Do you think that you're thinking about it in a black and white way versus allowing room for more nuance? And older kids will really maybe be able to speak to that a little bit better. Younger kids, it can be hard for them to kind of understand it either is this or that, but again, varying it to the age of your child. And kids can kind of understand, if you can relate it to other things, like, well, what do we know for sure? What are we not sure about, right? Like thinking about bigger questions where we don't always know exactly what's going on for sure. Like, does the weatherman know exactly what the weather is going to be tomorrow? No, he is making a guess based on the evidence. And so we don't know for sure that Kate doesn't hate you, but we definitely don't know for sure that she does. So let's talk about the different reasons why we think, maybe she doesn't. And so just allowing their brain to have a little bit more space for other options other than the worst case scenario. Do you think I'm misinterpreting evidence or making any assumptions? Do you think other people would interpret it differently? Are you looking at all the evidence? Do you think maybe you're exaggerating what you saw or what's true? Asking about thought habits. So if if you've been working on this rejection sensitivity with your child for a little while, they might understand that verbiage of, your habit is that your brain goes right to the negative, right to the sense of rejection. Do you think that, as we're trying to break that habit, let's look at the other facts. I also think this question is really powerful. Did someone make me think this, and are they a reliable source? So a lot of times when you get into like middle school, you might have kiddos come home and say, Maggie told me that Kate hates me because Kate told her that. Well, are they a reliable source? Do you really need to listen to what everybody's saying about each other? Because kids say mean things all the time. You don't necessarily have to believe that. So again, just asking those probing questions, not validating how they feel, but leaving room for, okay, well, that's one point of view, but let's look at the evidence, against that. And let's think about whether we really want to fully believe that, or if we think maybe we should be a little bit skeptical about it. Is my thought a likely scenario or worst case scenario? So if I ask a question of my teacher, he's going to say, I already covered that and you are the stupidest student I've ever had. Well, most teachers are not going to react to you like that. So a lot of times kids are thinking, when they're fearing a potential rejection scenario, they're thinking about a worst case scenario. And so thinking about what's a more likely outcome, even if they react negatively to you, they're not going to say anything that hurtful, and so it's probably worth taking the risk because likelihood is they're going to be okay with answering your question. Let's see, there's some questions in the chat. Let me see. Let's see, are people not able to see the worksheets? Are they not up? Okay, I'm sorry about that. Let me see.